The cardiac sarcoma is probably a different animal than sarcomas in the rest of the body. If you look at the outcome of cardiac sarcomas and the long-term outcome of these patients, it's far, far, far worse for cardiac sarcomas than it is for the general sarcoma in the rest of the body. Even when a person develops metastatic disease for cardiac sarcoma, it seems to be a higher mortality rate, even with those who have metastatic disease. So there's something different about these sarcomas that is as yet to be understood. More and more research is taking place into the molecular basis of these tumors. That's just starting to get started, but it's also very, very difficult to understand, very, very difficult to sort out. Every year I have, for the past 8 years, organized and ran a tumor course called the Toronto Cardiac Tumor Conference. This past year, we spoke specifically about the problems with cardiac sarcoma. It's online if your readers wanted to look at it. They just have to Google Toronto Cardiac Tumor Conference and review the most recent studies about that and talks about that. It's just getting started. It's going to be difficult to sort out because the tumors are so rare that even if you're doing molecular genetics on them or molecular studies on them, there aren't enough tumors to sort of figure out the differences and the similarities of the different tumors. I'm in the process of developing an international cardiac tumor database called the Interact project. That's just getting off the starting board now. Again, if you look at the Toronto Cardiac Tumor Conference a few years ago, we started introducing it. And we're in the process now of getting the database forms ready and getting people from around the world. We have input from around the world. It's a study like this, and only a study like this where we can get everybody in the world together to put our data together that will really be able to find out if there are any similarities, any differences, any moving forward of a tumor as rare as cardiac sarcomas needs to have international collaboration, not just national or continental. It has to be international. So that's what we're doing.